Welcome, everyone, to Open Enrollment Review, a Journey Medicare webinar. I'm really excited to bring this to you today. Journey tries very hard to present you with content that you find useful. And I think we've hit the nail on the head today. You know, there are so many questions surrounding Medicare re-enrollment. And we have Jonathan Burlison from the Nebraska SHIP office and UBT's own TJ Hansen from our Union Investment Management Group. And Jonathan's going to take you through changes to Medicare and what you need to know in order to make an informed decision. And then TJ's going to talk about why it's important to do your retirement check-in at the same time. Even though the two probably don't seem to have too much to do with each other, he's going to explain why it makes sense to do it now and what you need to do in order to make an effective retirement check-in. I'm Kelly Robert. I manage UBT's Journey program, and I am just super excited to bring you these two gentlemen. So without further ado, I'll introduce you to Jonathan Burlison. Jonathan, you want to let us know why you're here today and what we need to know?
Yeah, definitely, Kelly. I really do appreciate the invitation to provide some education on the topic of Medicare today. Certainly a very confusing topic, especially this time of year when folks are actively seeing a lot of commercials concerning open enrollment. So hopefully some of the material I provide today is going to help you better understand that Medicare program. I'm sharing my screen now so you folks can see my slides. Kelly, can you give me a thumbs up if you can see my slides?
Looks good.
Perfect. All right, so let's go ahead and dig in, folks. I'm starting my timer on my side so I can try to make sure I stick within the allotted time I have. So good afternoon, everyone. Again, my name is Jonathan Burlison. I am the administrator for the Nebraska SHIP. Briefly, if you are not aware of who Nebraska SHIP is, I want you to understand who is providing this education today. Nebraska SHIP is a federally funded program through the ACL, the Administration for Community Living. That federal funding means there is a SHIP program office in all 50 states and U.S. territories. So if you have friends or family who live outside of Nebraska and they're looking for help on that topic of Medicare, there is a SHIP program office in their area to utilize. Now, we are typically state managed. Here in Nebraska, we're a division of the Nebraska Department of Insurance. We certainly do serve the entire state, and we do so through a partnership with the Area Agency on Aging offices, as well as volunteers assisting seniors in the Omaha location. When you reach out to our 1-800 number, you are going to speak to someone live and local. That's what's so unique about the SHIP program. You are receiving local help for this topic of Medicare. So when you call our 800 number, you're going to choose the location you want to speak to, and you are going to speak to a Nebraskan. That's what makes our program so unique. Certainly, we do have a website that you are able to navigate and get some additional information. There are brochures and resources provided by our office and CMS. So definitely take a look at our website. With regard to what I'm going to discuss today, we are going to go through these quick topics of Part A, Part B, supplements in Part D, and certainly talk about Medicare Advantage plans, also known as Part C. And then we're going to look at the 3 C's, the things that should be considered during this time of year. And certainly folks are probably looking at the topics thinking, if you're already enrolled, you might be a seasoned individual and understand this. But remember, Medicare does see changes year to year. And sometimes those changes can affect even those folks who are currently enrolled into the program. So certainly we also understand that there might be some folks who are not yet enrolled in Medicare. So some of the information might be applicable to that situation as well. So first and foremost, what is Medicare? Certainly, of course, we want to make sure folks understand what Medicare is. To put it simply, it's federal health insurance, created in 1965, signed into law by President Lyndon Johnson. When first available, Medicare was only provided to those people who were age 65 years of age or older. It wasn't until 1972 that Medicare was expanded to include coverage for these other 2 groups of people, those folks younger than 65 with a qualifying disability disability, or those persons with end-stage renal disease. Now, certainly the image of the card in the corner, that is the current Medicare card. And remember, folks, that your Medicare card is a paper card. In Nebraska, we have reports of fraudulent calls coming in where people are being offered a plastic Medicare card in exchange for their paper card. If you get that phone call, hang up. It's okay to be rude. That person is a scammer. Medicare is not providing plastic cards. It is, again, a paper card. So just keep that in mind, folks. Now, beyond that, when a person is Medicare eligible, you are going to have two options in how you receive that Medicare benefit. Coming into open enrollment, you have that ability to switch from one option to the other. If you're currently enrolled in original Medicare, what you're looking at during open enrollment is most likely that Part D prescription drug plan. Certainly, if you're enrolled in the Advantage plan option, you're looking at that full structure of the Advantage plan. So definitely remember, during open enrollment, you have that ability to go from one option to the other. Certainly, a person could decide, hey, you know what, my supplement's getting really expensive here in original Medicare. I'm not really using it. Maybe I want to go to Medicare Advantage. So that is certainly the opportunity to make that movement. We are in that time period now, October 15th through December 7th. Now, again, we're going to focus in on some of the basics just as a reminder, because, you know, certainly Medicare is confusing. Hopefully this will help clarify a few things. Folks do want to remember your Medicare Part A. What this is doing for you is it's serving as your hospital insurance. It's paying for inpatient services. Listed on the screen, these four items are what Medicare Part A pays for: the inpatient hospital care, skilled nursing, home health care, and hospice. Now, as a reminder, remember, Medicare does not pay long-term care cost. So when you see skilled nursing, do not confuse that with a move into a nursing home. Medicare, like most insurance, again, does not cover long-term care cost. Now, certainly Medicare Part A is typically premium free. You've already paid for your Part A through 10 years of employment, paying your Social Security Medicare taxes. But in the event that you need to use your Medicare, there are deductibles associated with that, and certainly copays can apply depending on your situation. These amounts change year to year. What you're seeing on your screen are the values for next year, 2023. In the event that you are hospitalized, the deductible for that stay will be $1,600 next year, paying for the first 60 days of hospitalization. Now, certainly you do have access up to 150 days of inpatient hospital care. You do see that the slide indicates there are daily copays for those days 61 through 150. So certainly Medicare cost can accrue quite rapidly depending on a person's use. Skilled nursing, you see the first 20 days are covered next year at 100%, just like this past year. And certainly daily copays do exist for days 21 through 100. Next year, that dollar value will be $200 per day. So again, cost can accrue quite rapidly, but that's where those Medicare supplements come into play. And we'll certainly touch on that topic briefly today. Now, with regard to your Medicare Part B, remember your Part B is going to be the part of Medicare that you basically use the most. It pays for everything else outpatient: doctor's visits, specialists, lab work, x-rays, medical equipment, what have you. Certainly your preventative benefits are also provided by your Part B. Next year, your Medicare Part B premium is going to go down. We actually do see decreases every now and then, although the last decrease in premium was back in 2012. It does occur from time to time, so maybe it's an every 10-year thing. I don't know. But next year, we do see that the Medicare Part B premium is coming down. It will be $164.90. Certainly, if you have a higher income, you will see an IRMA, income-related monthly adjustment amount, imposed on the income at these values shown on the slide or higher. Specifically, what's being looked at is your modified adjusted gross income. So if your modified adjusted gross income is at this dollar value or higher, you will potentially receive that IRMA notification. But note that that is something that can be appealed. It is based on the tax return from 2 years ago. So certainly it's not permanent. Every 2 years, they're reevaluating that IRMA. Now, beyond that, certainly Part B has a deductible. That too is going down next year. It will be $226. Once you've satisfied that deductible, it is that 80-20 split with the Medicare program. That certainly has not changed. And remember, there is no maximum, there is no cap on that 20%. So that's, again, where supplements can come into play and be beneficial. As far as enrollment, again, I'm hearing that most folks in this call today are probably already enrolled, but if there's some folks who are not, remember that you have an initial enrollment period that's available at age 65. That period begins 3 months before you turn 65, and it ends in that 3rd month after turning 65. Now, one of the things that didn't get updated on this slide is you see up to 3 months after 65, there's a coverage delay. That is going away. Starting in 2023, the coverage delay during this enrollment will cease to exist. So again, changes come from Medicare, and this is a positive change because it has affected a lot of people in their planning. Certainly the Social Security Administration is going to be the office that you work with to do that enrollment into Medicare. And there's a number of ways for you to contact them. The 800 line shown here is the national number. If you call a local Social Security office, perhaps in Lincoln or Grand Island, wherever you might be in the state, you'll probably find your service to be expedited by calling local. Now, certainly there might be some folks listening in who maybe they're still insured through employment or possibly their spouse's employment. Do they have to enroll into Medicare at 65? And certainly the answer is no. More appropriately, it's no when we have a large employer. This rule of you don't need to enroll into Medicare at 65 is typically specific to what we call a large employer, an employer with more than 20 employees. So certainly most folks do take the Part A, dipping their toe into the Medicare pond, if you will. That produces a Medicare number, which helps expedite those processes if a person is enrolling into Medicare after age 65 at retirement. So definitely a person may not need it if they have insurance in place from active employment, their own or their spouse's. Now, certainly upon retirement, a person will have that special enrollment period where they will be able to elect their Medicare Part A or Part B. A person does have a window up to 8 months after the loss of their group health, but we don't see a lot of folks wait that long to enroll into the Medicare. Now, certainly if a person misses initial enrollment at 65 and they miss special enrollment upon retirement, the only other time they can elect Medicare is during the general enrollment period, that first quarter of the calendar year. Certainly, we're seeing on the slide that the coverage begins July 1st. That was a part of a delay or consequence that will no longer be there starting in 2023. Starting in 2023, if a person enrolls in January, coverage begins in February. If they enroll in March, it begins in April. So again, another improvement that is definitely a great improvement because that delay in coverage was really affecting some folks, especially when they need that health care. So definitely penalties can be avoided with Medicare as long as you're enrolled into that program if you do not have insurance from another source. So that's Part A, Part B in a nutshell. I could talk about that part of Medicare for a whole 2 hours, but I don't have that long. So let's go ahead and move on to Medicare supplements, a quick recap there. Remember that your supplement is an optional part of Medicare. You are not required to purchase it. If you decide to do so, what it's going to do for you is help you with your copays or co-insurance amounts. Certainly, you will buy this from a licensed insurance agent. It is a part of Medicare that does have some protections. The standardization of the policies means that the insurance policy will be offering the same level of coverage as a competitor. So if we're talking a G like George from a Blue Cross Blue Shield versus a Mutual of Omaha, the coverage will be exactly the same, even if there is a difference in cost. That's what that standardization does for you. Now, this slide is giving you a quick look at the various supplement options that exist. Think of Medicare supplements as being the part of Medicare that you get to customize, if you will. You're picking the level of coverage that seems most appropriate for you. Certainly noting that your cost in premium will fluctuate based on the level of coverage that you are obtaining. In Nebraska, a 65-year-old male non-tobacco user in our state, depending on where he's at, could see premiums anywhere between $30 up to $560 starting out. So definitely there's a large range, and this is definitely something that our office can help you weed through if you are potentially saying, hey, you know what, I have a supplement now, but I'd like to shop around and see what else is available. You can get that information from this office. Now, when you're looking at this slide, you are seeing some cost comparisons. The standardization of these policies means any insurance company who wants to sell a supplement, they got to sell that plan A because it covers the fewest required benefits. Certainly, we would anticipate that to cost less than a plan that offers the most amount of coverage. At this point, it's that G like George. That second cost example is just alluding to that standardization. It doesn't matter if you're buying from company Y or company Z, you're not getting anything less or more for the premium you pay. The plans, again, are standardized. Now, as far as purchasing, when and where does a person buy this? Well, if you're new to Medicare or perhaps you haven't enrolled yet, well, you have a 6-month window of guarantee issue period that begins when you start your Medicare Part B medical insurance for the first time at age 65 or after. Now, certainly if you're a person who already has Medicare in place and you have a supplement currently, you can shop around for a supplement at any point during the calendar year. It is not restricted to the current open enrollment. Supplements you can shop for spring, summer, fall, winter. It does not matter. One thing that will matter, though, is the answers you provide to the underwriting process. If you're shopping for a supplement after this 6-month guarantee, the answers you provide to underwriting questions will determine whether a policy is offered, and if so, how much will be charged. So you have that right to shop around for this particular part of Medicare, and if you would like some guidance in that, you're welcome to contact the Nebraska SHIP. Now, I know we're covering a lot of information quite rapidly. I only have a couple more minutes left, so we're going to go ahead and keep pushing on. Medicare Part D, the all-important prescription drug coverage. This part of your Medicare was introduced in 2006. What it does is it covers your brand or generic drugs. Next year in Nebraska, we will have 24 plans for you to choose from, with premiums ranging basically from $5 to $114. Certainly, if you have that higher income, and IRMA will apply, again, based on the tax return from 2 years ago. The maximum deductible nationally is $505. The majority of our plans in Nebraska do carry that deductible, and certainly you will have a share of cost anywhere from 0 to 50%, depending on variables. With regard to enrollment, well, again, initial enrollment, special enrollment, or the annual open enrollment is when you are going to be looking at this particular part of your Medicare. Medicare.gov is a wonderful resource for you to be able to do this research yourself if you choose, or you have the Nebraska SHIP office. We certainly do provide counseling sessions where you can speak with a person trained by our program to get advice on this topic. Now, certainly resources that you should be aware of if you are making changes, well, you'll want to make sure you understand where you can use that insurance. The pharmacy directory is an important tool. In you understanding where that insurance will work. Certainly a formulary, fancy word for drug list, is important. You want to know and understand whether or not your prescriptions are covered, of course. That's a huge point to remember during open enrollment. These plans get to make changes year after year. They work on a 12-month contract. Sometimes they change their name. Sometimes they change the cost you spend on premiums or copays. Sometimes they change the drugs they cover. Maybe your drug is covered covered this year, but it could potentially not be covered next year. Those are things that you do need to be aware of, and that's where open enrollment provides you the option of doing a comparison. Now, certainly the evidence of coverage, when you use your Medicare Part D, that is sent to you and it communicates what was filled on your behalf. Certainly take a look at that. Look for stuff that might be fishy. Maybe there's drugs listed that you did not fill. The explanation of benefits rather is that tool that you can use to make sure that you're just monitoring your own Medicare to avoid potential fraud or abuse. Definitely wonderful resources to be aware of. Now, Medicare Advantage, this is that alternative to original Medicare. What this option does is it combines the hospital Part A, the medical Part B, and typically the Part D prescription drug coverage into one package. I am going to stress this point. Medicare Advantage plans are not Medicare supplements. If you choose to enroll into an Advantage plan, you are effectively electing to have your Medicare managed by that private insurance company that is selling the plan. So it is, again, required to provide equal or better coverage. The better is typically coming from the extras of the dental, the vision, and the hearing. Now, certainly we would encourage folks to not make this decision based solely on the fact that they have access to dental or vision. You want to really make sure that the hospital, medical, and drug coverage meets your needs. Certainly also note that the availability of this option does vary. It is a network structure, so a network must exist. This year in 2022, there's 5 counties without this option. Next year, there will be 1 county, and it will be Cherry, that very large county that we have in the northwest part of our state. As far as cost, you will still pay your Part B premium. You might be charged a little extra depending on the Advantage plan that you enroll into if you do so. Certainly other costs do exist, deductibles, co-pays, and co-insurance. And because this option does not work with a Medicare supplement, instead it's the pay-as-you-go structure until you hit a predetermined out-of-pocket limit. In Nebraska, next year, anywhere from $3,000 up to $12,000. So certainly this is an option that is viable, but we always ask folks to remember Medicare is individual insurance. Is this option viable for you individually? As far as use, again, remember, it is a network structure. Typically, you're going to encounter HMOs or PPOs, and in that usage, you will potentially have prior authorization requirements, meaning you may have to ask for permission before you receive a certain service or item. If that Advantage plan denies that authorization, original Medicare A or B does not step in. Remember, again, you're electing to have Medicare managed by that individual policy, that company that's providing the policy. So again, is it viable for me individually? If you like statistics in Nebraska, 30% of Nebraskans with Medicare are receiving their Medicare from the Advantage plan option. Now, as far as enrollment, we see that theme. Do it at 65 for the initial enrollment, do it at retirement, and certainly know that there is that annual open enrollment to make changes as necessary. Enrollments can easily be done through Medicare.gov. You can certainly work with an agent who represents a company, or again, you have your partners at the Nebraska SHIP office. But before you do an enrollment, make sure you consider all the factors, and that's going to be those 3 C's. Before we dig into those, though, just a reminder on resources. Because it is a network, you will have a directory for the providers, for the dental, and for the pharmacy, assuming that it offers dental or drug coverage. Certainly the formulary and evidence of coverage and explanation of benefits are key items to know about as well. When we talk about the 3 C's, we're looking at cost, coverage, and convenience. These are the things that you really should be looking at during this particular time of open enrollment, So when we're talking about cost, remember that your actual cost is going to vary depending on these variables. The prescriptions you use, the plan that you've chosen, where those drugs lie within that plan's formulary, and certainly what pharmacy you use. Is it a preferred pharmacy or a standard pharmacy? Beyond that, your usage, or your cost rather, is also going to be determined by the level of coverage that you exist within. I'm going to pull out a laser pointer for this particular slide. Within Medicare, there are 4 potential levels of coverage regarding drug coverage. The deductible, certainly, once that's been met, $505 potentially, a person moves into what's known as initial coverage. Typically, most folks will finish their year within this, but if they do have higher cost drugs, brand names, insulins, inhalers, certainly those types of drugs may cause a person to fall into the coverage gap or donut hole as it was once known. The $4,660, what makes that amount is what you spend plus what the insurance spends. So when those two values combined hit 4,660, you fall in the gap. What pulls you out of the gap is when your spending hits $7,400 next year. If that happens, you enter catastrophic coverage where your share of cost is 5% or these set dollar values, whichever happens to be higher, excuse me. So definitely the cost is going to be something to be aware of. The evidence of coverage, or rather the explanation of benefits that's sent to you monthly, it will outline these dollar values and help you keep track of where you're at. Are you getting close to the coverage gap? If in it, are you getting close to exiting it? Very important resources. And because, of course, these costs can be, challenging for some individuals, there is a program known as Extra Help. Extra Help is administered by the Social Security Administration. A person is able to apply for that assistance, and if they qualify for it, what it's going to do is help make drug costs easier, potentially lowering premiums, deductibles, and copays for that individual. The asset requirement does not include your home, nor does it include your vehicle. Beyond that, coverage. You really do want to make sure that you're choosing a plan that offers coverage for the particular prescriptions that you take. Certainly, I also get those questions. Well, what if I don't take prescriptions, Jonathan? What happens next year if I am prescribed something? Well, remember that Medicare mandates that these plans offer coverage for drugs within each drug class or category, basically meaning 2 to 3 of the most commonly prescribed drugs. So that's why we need to make sure we're aware of that formula. Are my drugs covered by this particular plan? The other thing to remember is restrictions can exist within drug coverage as well. Prior authorization, step therapy, or quantity limit. Quantity limit. So if restrictions are in place, this is something that could potentially affect your prescribed therapy. Certainly, you do have avenues to address these restrictions potentially, and the Nebraska SHIP office can certainly educate you in some of those avenues. Now, beyond that, the last C of convenience. Where do you want to use this insurance? Remember, preferred pharmacies typically will fetch you the lower out-of-pocket cost, whereas a standard pharmacy, you can use it, but you may end up paying a higher standard cost. Sometimes the cost difference between these two is significant, and that might prompt a person to think, hey, it might be worth the extra couple of miles or the extra couple of minutes across town or what have you to secure lower cost. Now, I did say that preferred pharmacies typically fetch the lowest cost, but that's not always 100% true. Sometimes a standard pharmacy can offer a lower cost than a preferred. So that's why we really do encourage folks to consider more than one pharmacy in the event that you are doing a comparison. The Nebraska SHIP office, we are here to help with this very topic. We can help you over the phone or in person, or certainly through one of these tools like the WebEx or the Zoom. We exist to provide unbiased local help, and certainly note that our counselors are very well trained to provide this education to you. We just came out of our fall update, and everyone is armed and ready to answer those questions. So I know I covered a lot of information quite quickly, but definitely, again, you have the opportunity to call our office and have a one-on-one conversation about your personal situations. So I hope there's questions afterwards. I do love questions, but I'll go ahead and turn it back over to Kelly. Thank you, Kelly.
No, thank you, Jonathan. That was fantastic. So much information, great information. And I know that our attendees are going to have a ton of questions. Thank you for making that so easy to understand and for making resources available.
Definitely.
I'm again excited to introduce our next presenter, TJ Hansen from Union Investment Management Group. It's going to talk about that all-important retirement check-in. TJ, take it away.
Awesome. Thank you, Kelly. I'll share my screen here. Let's make this. All right. How does that look, Kelly?
Beautiful.
Perfect. Again, my name is TJ Hansen. I work at Union Bank and Trust. I'm a wealth advisor. And today we'll be going over the year-end retirement checklist. So this presentation is going to be targeted at individuals that are currently in retirement or are nearing retirement. If you're not in one of those two categories, I'm sure this will be of value of you still. So today, I'll explain what I do on an annual basis with clients when they come in for reviews. And then we'll dive into important topics to consider while you're in retirement or nearing retirement. So let's get started. Here's our disclaimer page. Main thing here is just that this is education and not financial advice. Just one thing that we always have to include in presentations. So our financial planning process. So as a wealth advisor, annually, I'll go over this with clients. So we'll define the goals, we'll evaluate assets, perform the gap analysis, provide options, implement strategies, and then review your plan. And the reason that we do this on an annual basis is because things can change. As we know, whether it's in retirement or out. So here's a list of examples that can make the financial picture a little bit messy. One that I'll highlight is the large unexpected expenses. Whether it's in your, in retirement and there was, a car broke down or medical bills piled up, things always seem to get shot at you, and it shouldn't change the financial picture totally. Hopefully, we have some tools in place, whether that's an emergency fund, which is typically 3 to 6 months of living expenses, but it shouldn't change the long-term view of why we invest and why we have retirement. So identify the financial good and bad for 2022. So what went well and what didn't go as planned. The way that I always like to break up these two is thinking about what are the things that you can control and what are the things that you can't control. Example of things that you can't control is what markets do. And maybe even what we mentioned before, some of the medical bills or other costs that might pile up, but then also what can you control? So perfect example of this is spending in retirement. I have clients that retire off of $400,000 and maybe they have Social Security and pensions and they're just fine. And sometimes there's people that retire off of 2 million and have trouble just because spending is so high and maybe their lifestyle is a little bit more expensive. So. And then set goals for 2023. This is always a good practice, kind of the fun part with you and your spouse, or maybe even own personal goals that you have. Because as advisors, we want to make sure that we cater towards your goals and we build the financial picture around them. So evaluate spending. Back to spending. One common practice that we always do with our clients. Again, that's one of the most important things is making sure that we understand spending. So we add up the annual expenditures for the last 12 months. If you bank with Union Bank and Trust, oftentimes that's available where we can go in if you would prefer us to, and we'll add up that total for you. But many other institutions, or even if you have credit card statements, just tracking spending is one of the most vital things in retirement. Withdrawal rates, you guys might be familiar with the 4% withdrawal rule in retirement. Essentially, I'll use the example of retiring with $1 million, but 4% of $1 million would be $40,000. If you could use that to supplement retirement in this specific scenario that I'm giving, that along with Social Security and if you had any pensions, essentially the reason for 4% withdrawal rule is so well known is when you retire, that the principal that you start with, so in this example is $1 million, we should see no decrease in that principal, if anything, hopefully an increase. And then evaluate income. One thing that I would add to this slide would be pensions, Social Security. You see there it says RMD amount, and we'll get into RMDs later, but that stands for required minimum distributions. And then any rental income or any part-time income, we always look at that with clients, make sure, are you earning any income in retirement? So kind of into some specific topics here. Social Security, you guys might have heard this past week, the largest cost of living adjustment. It was 8.7%. It doesn't come unexpected. We've obviously seen inflation ramp up these last 9 months specifically. A good thing, and always a rule of thumb, is applying for your benefits 4 months before you start. Sometimes Social Security Administration can be a little bit delayed. So oftentimes if people retire at 65 or 67, whatever it might be, and they say, I need to have benefits starting next month, we typically see that actually take a few months. So always good practice to apply up to 4 months before. And then Social Security eligibility, it begins at age 62. You cannot start receiving benefits prior to age 62. On to full retirement age. So what is full retirement age? We'll just dive into this graph here. If your birth year, so on the left side, is between 1943 and 1954, you have a full retirement age of 66. Everyone on this call has a full retirement age. If you're born in 1960 or later, it would be age 67. So oftentimes clients will say, I have paid into Social Security, I just want to take a benefit as soon as I possibly can. And as we know, that's age 62. But let's kind of create an example here. If there's somebody born in 1963, their full retirement age would be 67. If they were to take benefits at age 62, which is the earliest that you can, and let's say in this example that it's a $1,000 monthly benefit that they would expect at full retirement age. So if they elect to do that at age 62 rather than waiting to 67, they would see a 30% reduction in that benefit. So rather than receiving $1,000 a month, the individual would only receive $700 a month. And $700 would be permanent from age 62 to the end of your life. There is none, it's not, you wouldn't receive $700 up until a certain age of 67, let's say. It would be $700 for the rest of your life. And then working may impact benefits. Some of you guys might be aware of this. Again, we'll just kind of dive into the graph. If you're under full retirement age, and I always kind of this side of the graph that says what happens above the limit, you don't need to pay attention too much on that part because it can be a little bit confusing. But if you're under full retirement age and you make more than $19,560, then your benefit will be reduced. In the year that you reach full retirement age, if you make more than $51,960, then you as well will have a reduced benefit. But from there on out, at full retirement age and older, there is no limit on earnings. Retirement savings. This is always kind of a fun one to explain. So you have until April 15th, 2023 to make 2022 IRA contributions. So let's pause there. Sometimes that's hard because people will say, I thought that I had only until the year, end of the year to contribute to my IRA. So the two types of accounts that we're referring to here would be a traditional IRA and a Roth IRA. Those two accounts, I'm sure that some of you guys are familiar with it. If you're under 50 years old, you can contribute up to $6,000 in your IRA, and if you're 50 plus, you can contribute up to $7,000, so an additional $1,000 contribution. We see in the bold here when we mainly see somebody making a contribution to a prior year, that typically is when maybe someone has a bonus late December, maybe they get a raise in early of the following year. Maybe in February, they receive a little bit of inheritance and they haven't maxed out their IRAs in prior years. So they'll call up me and they'll mention, hey, I didn't do any contributions in 2022. Can I still make contributions? And you can in those two accounts up until April 15th of the following year. So I've had many clients sometimes max it out, both of them and their spouse will do $14,000. And then on the same day, maybe if they have extra funds to invest, they can do $14,000 for 2023. That can be kind of confusing for some people, but it's just important to note that at that point, then everything's fulfilled on that end. This is opposed to, employer-sponsored plans. So what we're referring here is 403Bs and 401Ks, and also your HSAs. Those do have contributions due by the end of the year, which is 12/31. And last thing to kind of pay attention to is new contribution and income limits. These are constantly continue to increase as inflation does too. Right now for your 401K and 403B, you have contribution limits of $20,500 if you're under 50 years old, and you have additional catch-up contributions of $6,500 for a total of $27,000 in 2022. So review current insurance coverage. Main two things I kind of want to highlight here would be long-term care and life insurance. At Union Bank and Trust, we don't sell any insurance products. Oftentimes people like our input just because we obviously can't put them into a product. And we have just a pretty neutral point of view on it. Both of these, long-term care and life insurance, especially when you're in retirement, can be big decisions. And seeing if it makes sense for you is kind of a unique situation and depends on your unique situation. Tax planning. What is tax loss harvesting? Essentially, this is only when it's in a taxable account. And maybe, when markets were performing really well between 2010 and 2020, you might have large holdings or large gains in a holding like Apple or other, equities that have outperformed. And maybe recently, due to markets being down, you actually have some positions that are at a loss. So oftentimes just, getting with your accountant or your financial advisor, making sure, hey, do you see any value in other areas of the market? We'll maybe tax loss harvest some of those positions to make it easiest on your tax picture, but also get you into areas that we think are valuable. RMDs, QCDs, and Roth conversions kind of build off of one another here, or at least how I'll talk about it in the tax terms. So required minimum distributions, that's what RMD stands for. And at age 72 years old, for your 401k that's turned into an IRA now, or maybe you just had a 403b, now it's an IRA. Essentially, all those pre-tax dollars are subject to RMDs. So at age 72, and there's a table out there, but I think at age 72 is 3.5% first year. Essentially, the IRS is saying we want you to take some of this money so we can obviously get a cut or portion of it as well. So you'll be subject to those, and that kind of leads into QCDs. If you do feel charitably inclined, this is a good way that you take your RMD. It stands for qualified charitable distributions, and oftentimes it's a good tax planning strategy to lower your adjusted gross income while giving to a charity of your choice. And then Roth conversions. It's always tough. Do Roth conversions make sense in my scenario? Oftentimes it's most applicable for someone that's when they're retired and they're used to having a very large tax bill, and before the age 72, because that's when they'll have to take RMDs. Roth conversions may make sense during that time. It just depends on your goals, that how you maybe like to leave wealth for someone someday. So if you ever have any questions like that, I'm sure that we can field them at the end too. If not, we can follow up one-on-one and talk and discuss. And actually, I just explained this Roth IRA conversion, but pro tip on the side, I like that they included that there. You can conduct multiple conversions over time. So there is no limit. You can do it multiple times throughout the year. Typically it only takes one. Like I said, it's typically between the years that when they were working and before they start RMDs, they might realize, $20,000 in taxes during that time. And once you convert it over to a Roth, there are no RMDs and no taxes on distribution. That's why it's always advantageous. If people always talk to you, what's the best thing about the Roth IRAs? It's when you withdraw and you take a distribution, there's no taxes on that. So that's obviously a big benefit. The estate plan review. One thing that I really want to highlight on this slide would be the beneficiary designations. So we'll work with clients and they'll say, TJ, I have everything done with my will. As far as estate planning goes, it's just going to go to my spouse. And then if he or she were to predecease me, then it will go to our kids equally. And I say, perfect, we got everything at the will. But beneficiary designations, why it's always important to keep up to date on those is because And it's a term that's called supersede, but beneficiary designations will supersede what is stated in the will. So if you started a job at age 25 and you opened up a simple IRA and you had a beneficiary designation of your sister, well, upon your passing, if you never changed that, your sister would actually inherit that investment account. So it's always a good rule of thumb to make sure that we have beneficiary designations up to date. I always try to contact our clients within a 3 to 5 year stretch, just making sure that everything's the same for who they'd like to inherit it. And then charitable giving, we've talked about QCDs a little bit today. One thing on this slide that I'd like to cover is the annual gift exclusion, which is $16,000 for 2022. Oftentimes, if people are charitably inclined, they'll say, well, I want to, in a scenario where maybe they have 10 grandchildren, they'll want to provide $2,000 to each grandchild for education costs. And there is a gift tax out there. So obviously that's $2,000 is lower than the $16,000. But if you were above that $16,000, it's on a graduated system like federal tax, but you would have to pay gift tax on anything above $16,000. But anything below, you could contribute to your grandchild's education. And always important to note that those increase over time too. So maybe in 2023 we'll see 16,500 or maybe not. But essentially, it's always good if you are thinking about gifting away funds, knowing what that gift exclusion tax would be. And then asset diversification review, rebalancing may be needed due to market changes. And then keeping an appropriate asset allocation is key. Obviously, we know that asset allocation drives returns. In retirement, we may not have to be at 100% equity. And on the flip side too, we probably don't need to be at 100% fixed income as well. We've seen over time that the riskier you are, the higher the reward that you'll potentially get, but also maybe the lower returns in the short term or volatility could be an issue too. Other thing is fees. Know what you are paying for the investment. So at Union Bank and Trust, we use what's called Class I shares. They stand for institutional shares. They have very low expense ratios, no sale charges on it. Oftentimes people don't know what class of a share they're in. There's some that have Class A or Class C. They might have a sales charge, and then within the fund too, they might have a high expense ratio. The reason it's always important to look at fees is they can drive long-term returns. If you have larger fees in one, and even if it's underperforming, if it's outperforming, hopefully it's outperforming by the amount of fee relative to the market. And then lastly, financial advisor check-in. Simply put, is your advisor doing what you need them to do? Ask them if they're a fiduciary. How much planning have you done with your advisor? Do you feel ready for retirement, or are you, how is retirement going? And do you have access to your advisor for questions? All these are great things to talk with them about and just discuss on an annual basis, if not even sooner than that. So thank you guys for listening to me. Again, my contact information is down below. If you do want to talk one-on-one about your special situation, we sure can do that. But I think I'll turn it over to Kelly and we can open it up for questions.
Great. Thank you, TJ. Thanks to both our presenters today. That was a lot of information and a lot of really good information. So we are most appreciative. I do have some questions here. Oh, and I have a comment. The first comment is, I got the best advice from my UBT planner about charitable deductions. Thank you. So they must have been struck by that inspiration when you were talking about charitable deductions. So way to go if that was you, TJ. If not, if that was one of your team, kudos to them.
Yep.
Do you charge to discuss tax loss harvesting?
We do not. In fact, that what we need for to see if tax loss harvesting makes sense would just be your most recent statement from whatever, if that's a firm, just because we need to see the basis that you have within your current holding, and then just seeing the total value of the account. So as long as you have that information, no, we don't charge you anything for that.
Sure. Okay, great. Thanks. Oh, and Vicki just said thanks to speakers for a wonderful presentation. I agree, Vicki. Thank you. All right, next one. Jonathan, I'm going to guess that this is one for you, although TJ could certainly take a stab at it. What happens if I switch to an Advantage plan and my preferred hospital is out of network?
Well, if you switch to an Advantage plan and the hospital or provider is out of network, you are paying full cost for that, depending on the structure of the Advantage plan. If it's an HMO, you're paying 100%. If it's a PPO, preferred provider organization, certainly that hospital or provider could accept it as out of network. Typically, you're probably going to pay about 50% or less, depending on the chosen Advantage plan. So certainly that's one of the bigger things to take into consideration if you are evaluating Advantage plans. Does this network meet my needs?
Yeah, and you did stress that for us. So thanks, and great question. I'm guessing that's what prompted this question. What should I consider when looking at Medigap or something similar to get me through the donut hole?
So when we're talking about the donut hole, that is specific to prescription drug coverage. Folks need to remember that Medicare supplements do not help with Part D drug expense. Your Medicare supplement is there to help for Part A, hospital expenses, or Part B, medical expenses. So if you're a person who is seeing that donut hole that during the drug coverage, things that you can do, well, if there's a specific medication that's causing a higher out-of-pocket cost, there's a couple things that you can do. Certainly, you know, one of those older suggestions is, well, see if the doctor can give you samples to get you through. Certainly, that's one option. One that's definitely not a full fix, though. There are coupon websites that exist. GoodRx, for example, is one that we do see a lot of folks utilize. GoodRx is a coupon website that essentially allows you to print coupons or get coupons to your email or by text and use those at select pharmacies for a reduced cost. Now, certainly if a GoodRx coupon doesn't exist for the particular drug in question, or if it's just a drug that's really expensive, like an Eliquis, for example, another alternative would be certainly seeking out a pharmaceutical assistance program. A resource you can use for that research is Needy Meds, NEEDYMEDS, needymeds.org. That is a nonprofit website that exists to provide you information as to whether or not a pharmaceutical assistance program exists for a particular drug. Those PAPs, as they're known, they may have different requirements. Some of them are looking at income, well, others are not. So I always encourage folks to reach out to those and fill out an application. The worst thing they can do is say no. Certainly extra help is available. We highlighted that for those folks with limited income or resources.
Okay, great. Thank you. This one may be too specific. Maybe not. This may warrant to the asker, this may warrant a chat with Jonathan. We'll let him decide. Next month is the start of the 3 months before my 65th birthday. While I am on my employee's PO and plan to be on it for another 2 to 3 years, multiple people have told me to register for Medicare Plan A now, mainly because it's free. Are there any disadvantages in doing so? Will it cause...
Yeah, great question. Sorry, I cut you off. You didn't get to finish posing the question. Was there a little bit more to it?
Will it cause claim confusion with my PO carrier?
Gotcha.
PO carrier.
So when we're looking at the situation of an individual having employer insurance from active employment and a person chooses to enroll into just Medicare Part A, remember that there is an office known as Coordination of Benefits. Coordination of Benefits is that office at Medicare that determines who pays first. Clearly, Medicare is looking for someone else to be responsible if if that does exist. So in the event that you have what's known as a large employer, more than 20 people are employed at this entity, and you're getting your health insurance from active employment, coordination of benefits states that the group health insurance from employment pays first, Medicare pays second. Remember, Part A is specific to inpatient hospitalization, so it would only pay in the event of that. Now, the other thing to note, though, is, well, is there a potential drawback to taking just the Part A? The slide that I had up when it was talking about, do I enroll at 65, there was a note, a bullet that said, if you have an HSA, this could affect some decisions you have to make. The HSA, the health savings account, specifically paired with a high deductible health plan. If you have one of those in place and you want to continue to contribute, or maybe your employer's contributing to it, getting some free money, essentially, enrollment into Medicare would not occur. You would not want to do that because contributions into the HSA would in fact see tax penalty come April 15th. So as if it's not confusing enough, let's say a person says, hey, I have an HSA, I want to still contribute, maybe I'm going to work until full retirement at 67. What that person needs to realize with Part A is retroactively dated after age 65. They backdate your Part A 6 months. So in the event that a person is, say, for example, wanting to retire in August and have Medicare effective September 1st, the Part B medical would be effective September 1st, but the Part A would actually get backdated to March 1st. So in that case, you could do the January and February contribution to the HSA, but you probably wouldn't want to do the March through August because that would see a tax penalty. So certainly we always encourage folks to reach out to the organizer of the HSA to get more details on that particular situation. Beyond that, again, just taking Part A, typically it's going to pay secondary to group health insurance. If we have folks in here with a small employer, less than 20 people, enrollment into Medicare is encouraged because coordination of benefits says Medicare pays first when it's a small employer. So if you have a personal situation you'd like to discuss a little further, please reach out to our office.
Perfect. Thank you. And I should have said that the asker did say that he did not have an HSA. I think we have time for two more. We're cutting it close here. I will read the next two in the chat box and then encourage you to reach out to SHIP or UIMG individually. Next one is, I have an F plan. F is in Frank.
Mm-hmm.
If I change to Advantage plan for a year and it doesn't work, could I go back to Plan F?
So it depends. So basically within Medicare, Medicare does provide a trial right for the Advantage plan. I'm going to call it a test drive. So the two instances where a person can test drive an Advantage plan is, let's say, for example, the person is turning 65. They immediately enroll into both Part A and Part B and enroll into a Medicare Advantage plan. They will have a 12-month period to test drive or try that Advantage plan. If they don't like it and leave that Advantage plan within the 12 months, they will have a guarantee issue for a supplement. The second trial right is more applicable to this question. Let's say the person, when they started Medicare, they took A, B, and a supplement, in this case an F. Let's say they decide, maybe I do want to try the Advantage plan. Well, if it's the person's very first enrollment into the Advantage plan structure, they also receive that 12-month window of a trial right, the test drive. Timing is very important. And certainly you would not want to wait until the 12th month to disenroll if you didn't like the Advantage plan. You're going to figure that out sooner than later, hopefully. In that case, essentially, if you disenroll within the 12 months, you are allowed to return to original Medicare. With regard to the supplement, you must take back the supplement you had prior to enrolling into the Advantage plan. Now, if that company doesn't sell it anymore, then you have a 2-month window to replace what you lost with a guarantee. So again, it's going to depend on the individual situation, but typically the trial right is that very first enrollment into an Advantage plan.
Perfect, thanks. And someone in the chat feature, I'm guessing it was one of our gurus from Omnify, has already suggested that the ASCR review the new drug coverage recently passed by Congress. The question was, supposedly insulin costs are to be reduced, initiated by the president. Is that supposed to be in effect in 2023?
So the Inflation Reduction Act regarding insulin 2023 is one of the very first. We will see changes in 2023 regarding insulin. And essentially what we're going to find is that it is a $35 copay for any insulin that is on the plan's formulary. Now, certainly there are plans that may still participate in the insulin savings model. That was enacted in 2020 and it's in place through 2025. The insulin savings model was put into place to try to reduce insulin to an affordable cost. Sometimes the insulin can be obtained for less than $35. But with the Inflation Reduction Act, what that will do is it will impose that $35 limit on any insulin that is covered by that plan's formulary. So you do really want to make sure, is my insulin on this plan's formulary?
Okay, great. Gentlemen, you've been super helpful. TJ Hansen, Jonathan Burlison, folks, I would encourage you to reach out to these individuals and their teams for your questions. A big shout out to Nate Gleaves, who helped us out today. Thanks to all of you for giving up a big slice of your afternoon to join us. We look forward to seeing you again. Our next event is coming up. It'll be here before you know it. Take care, everybody, and enjoy your afternoon. Thanks. Bye-bye.